Hi, I'm Andrea. I've been a NICU nurse for over a decade. We all know that phototherapy is fairly common in the NICU or nursery or even the peds unit. But even if it is common, it doesn't mean that it's necessarily easy or simple to do. I'm here to share with you phototherapy hacks to help make it easier for you to do your job well and to take care of those babies and their families. So let's get started. For the first phototherapy hack, make your life easier by knowing the tools at your fingertips available 24/7, 365 days to help you determine when is the right time to initiate phototherapy. There's a great website that takes the American Academy of Pediatrics guidelines into consideration. This tool is billytool.org. We've all been there at some point. You have a baby whose bilirubin is high, you think you should start phototherapy, but it may be intimidating to call the doctor late at night unless you are sure. So check out billytool.org. Here's a phototherapy hack for parents. Being in the NICU can be very traumatic for parents and they can feel really helpless, especially when all they want to do is hold their baby. So if their baby needs phototherapy, you can allow them to continue to hold and bond with the baby while getting high-intensity phototherapy with the BillySoft. Remember, high-intensity phototherapy is the use of high levels of irradiance in the 430 to 490 nanometer band, usually 30 microwatts per centimeter squared or higher, delivered to as much of the infant's surface area as possible. Family members can still hold the baby while on phototherapy. It's a win-win. You don't have to take the baby off of phototherapy, and the parents get to bond with their baby and feel like they are helping with the care. The BillySoft promotes family-centered care, and family-centered care can be an important component to patient satisfaction scores. Do you have the right meter for your phototherapy device? Do you know what color it is? I can tell exactly who made it and how old it is by the color. The American Academy of Pediatrics Clinical Practice Guidelines says that you should check your phototherapy dose periodically to ensure that an adequate irradiance is being delivered. For the BillySoft, we recommend that the system is checked for desired therapeutic intensity before use with each patient. I've taught at some units where the protocol is to check it once a shift because it is a dose. And you want to make sure that the dose is effectively decreasing the bilirubin. Older phototherapy lights gave very low doses, potentially extending the period of time that the baby would need to remain under phototherapy. So it can be frustrating for you, the baby, and the parents if the phototherapy is not effectively bringing down the bilirubin levels. Now I will show you how to easily check the irradiance levels of the BillySoft. Take measurements on the lit side of the pad using the meter placed at points as shown on the back of the pad. For the small BillySoft 2.0 pad, if I take the readings in the middle, C and D, and take the average of C and D, if it is greater than or equal to 60 microwatts per centimeter squared per nanometer, then it works. If you get less than 60, you'll want to do a full check. You check all 6 points and you take the average. If it is less than or equal to 39, then it's time to replace the LED in the box. If you have the large BillySoft 2.0 pad, to do the quick reading, check the center row, D, E, and F, and take the average of it. If it is greater than or equal to 40, then it's okay to use. If it's less than 40, then do the full 9-point check. If the 9-point check's result is less than or equal to 27, then it is time to replace the LED. Now let's talk about interpreting physician orders. Some physicians were trained as pediatricians prior to the 2004 AAP Clinical Practice Guidelines for Management of Hyperbilirubinemia in the newborn infant 35 or more weeks of gestation. In that time frame, clinicians were adding devices around babies thinking that we were adding additional dose or therapy for babies with high bilirubin, when in reality, we were adding the same dose and likely only increasing surface area coverage. Thus, some of the phototherapy orders prior to 2004 did not meet the dose requirement or spectral range, which we know is effective to break down bilirubin, which is now considered intensive phototherapy. So orders were written as single, double, or quadruple, with rarely a dose range. Fast forward to after 2004 and today's standards. AAP decided to mitigate this ongoing risk by renaming orders for intensive or conventional with specific dose ranges attached to those. For effective phototherapy for infants greater than 35 weeks gestation, per the AAP guidelines, effective phototherapy is an equation of the exposed surface area coverage, light wavelength, the irradiance or intensity of the light. And equally important is the duration of exposure to phototherapy to decrease the bilirubin to safe levels. These 4 things help to make up the effective overall dose of phototherapy. A more clear clinical definition would be high-intensity phototherapy, which implies the use of high levels of irradiance in the 430 to 490 nanometer band, usually 30 microwatts per centimeter squared per nanometer or higher, delivered to as much of the infant surface area as possible. You can increase the dose or maximize phototherapy by increasing the surface area coverage. A phototherapy blanket like the BillySoft can be placed underneath the baby, and an overhead phototherapy light can be above, such as the Giraffe Blue Spot. You can also increase the dose or maximize phototherapy by decreasing the distance between the lamp and the infant. So with the BillySoft, the baby is lying on the pad and can get as much as 50 microwatts per centimeter squared per nanometer with the small pad, and 35 microwatts per centimeter squared per nanometer with the larger pad. And you can pull the Giraffe Blue Spot PT light closer to the infant's skin. For example, at 38 centimeters distance from the baby, you can get up to 45 microwatts per centimeter squared per nanometer. Here is another phototherapy hack. How many times do your babies have to have an X-ray? Sometimes it's as much as 1 to 5 times a day. Why risk interrupting phototherapy multiple times a day just to get an X-ray? The easy thing about the BillySoft is that you don't have to take a baby off of it when doing X-ray because it's radiolucent. Now here is a cleaning and storage hack. To make sure that the BillySoft unit works properly and doesn't break, be mindful about these things. Don't set the box on top of the pad in the clean storage area because it can damage the pad. If the pad is damaged, you may break the fiber optic fibers or create discoloration on top of the pad, which could decrease light intensity of the light pad. Instead, a suggestion would be to hang your pad somewhere near the box where it's easy to see and find without damaging the fibers when you put additional equipment on them. You can also wrap the cord around the box and let the pad hang to the side. Here is a nursing tip. My favorite way to use the BillySoft is to just hang it off of the side of the bed. It makes your life so much easier and cleaner than putting it on the floor or the drawer or just on a shelf where someone or a parent can knock it off. You can order special brackets that allow you to hang the BillySoft off the warmer, an incubator, or the Omnibed. That way, if you have to reposition the baby, you just simply disconnect the cable, move the baby while it is still on the pad, and then just reconnect the plug without having to move the box. Now, what if your baby moves out of that bed? Then you pick up the box and place it on the nearest shelf or counter surface closest to the baby's bassinet, crib, or chair if mom or family is holding and bonding with the baby. So here's a tip for NICU babies. We get questions on whether or not we can use BillySoft in preterm infants. Given what we know about the neurodevelopmental vulnerability of infants less than 35 weeks and of extremely low gestational weights, it is critically important to have practice recommendations in place for the initiation and use of phototherapy. While there has been no guideline published by the AAP for treating hyperbilirubinemia in infants less than 35 weeks, the AAP has recognized that there still existed a need to provide some guidance. So in 2012, they asked a group of experts to provide some recommendations. It says, because of the reported increase in mortality in infants with birth weights 501 to 750 grams, it seems prudent, at least in infants with birth weights less than 750 grams, to initiate phototherapy at lower irradiance levels and only to increase these levels or to increase the surface area of the infant exposed to phototherapy if the total serum bilirubin continues to rise. So here's the easy way to remember what to do. If your baby is greater than 750 grams, BillySoft can still be a first-line tool for the extreme premature infant because of the intensive dose. Per the recommendations, if a baby is less than 750 grams and is not responding to conventional phototherapy, less than 30 microwatts, then guidelines recommend that you can add additional therapy and increase the irradiance or surface area of the infant exposed to phototherapy. At this point, you should think to add BillySoft. If you had an infant less than 750 grams and needed to initiate phototherapy, then try the Giraffe Blue Spot PT and raise the lamp so the dose is no longer intensive, i.e. less than 30 microwatts per centimeter squared per nanometer. If the total serum bilirubin levels are still continuing to rise, then per the 2012 consensus recommendations, you can increase the irradiance levels by bringing the Giraffe Blue Spot closer to the baby or increase the surface area and bring the BillySoft to put underneath the infant. Just remember, these less than 750 grams babies, although we see them, constitute less than 2% of babies born. In fact, the Centers for Disease Control and Prevention, which tracks birth rate, reported that the rate of very low birth weight, less than 1,500 grams or 3 pounds 4 ounces, is about 1.44% of all US births as of 2011. So for preterm infants that are less than 35 weeks gestation and are greater than 750 grams, the BiliSoft is still an available option for them to get effective, high-intensity phototherapy. Here is a newborn nursery hack. Why are you using a Bili bed when you can use a soft blanket and the baby can go to mom's room? Why not treat the baby like a baby? That way, mom can still interact with the baby and the BiliSoft can go anywhere, anytime. Speaking of going places, why stop phototherapy when you need to go to a test off of the unit, like radiology? You can still keep the baby on the BiliSoft. Or why delay phototherapy, which may have already been initiated, when the baby has to be transported to another facility? Also, why wouldn't you start phototherapy when the baby needs it immediately? BiliSoft is flexible enough to allow you to keep the baby on phototherapy even during intra-hospital and inter-facility transport. Now here's a hack for those of you working in the pediatric ER. A 2013 study published in Pediatrics showed that 35% of early readmissions of apparently healthy newborns after discharge from well baby nurseries were because of jaundice. So if you are at a pediatric freestanding ER, babies with hyperbilirubinemia may come to your doorstep. So you may need to start phototherapy right away. Don't wait, initiate. Even if your referral hospital is only 20 minutes away, it may take more than 2 hours before your baby can get the phototherapy treatment that they need. You can easily start phototherapy on any admission bed you have in any room. BiliSoft can be a great way to do it. Every minute is critical if the baby has a high bilirubin level. How about an accessories hack? What would you do if you don't have the right cover for your BiliSoft? You might grab a pillowcase or paper, etc. That was a trick question. You really need to seek out and use the actual cover for this product. Otherwise, the patient will not be getting the appropriate dose of phototherapy, if any at all. You cannot use the pillowcase, scale paper, etc. You must use the BiliSoft cover or BiliSoft nest so that light actually penetrates and delivers a dose to the patient and protects the baby on the pad. Speaking of covers, don't forget covering the baby's eyes. Use eye protection for the baby while on phototherapy. Direct exposure of the eyes to any phototherapy light may cause eye damage. Always protect the baby's eyes with eye patches or an equivalent appropriate eye protection product. Periodically and/or per your hospital protocol or healthcare provider's instructions, verify that the patient's eyes are protected and free of infection. Care should also be taken to protect the eyes of patients adjacent to the treatment area when necessary. Thanks for tuning in. We hope you found these phototherapy hacks, tips, and tricks helpful. Bye!